If your life has not been impacted by breast cancer, you're one of the rare and fortunate ones. Breast cancer is the second most common cancer among women behind skin cancer. It's also the second leading cause of cancer death among women behind lung cancer. And at Mayo Clinic, they are leading the charge as it is changing those statistics through advanced research, innovative diagnostic testing, and world-renowned treatment. There is a lot we know about breast cancer and so much more that we don't. That's why all this week we are going to tackle this subject in a 5-part series called Inside the Fight of Breast Cancer. And tonight we begin with early detection. Joining me now are Dr. Christine Klassen, who is the director of Mayo's Breast Diagnostic Clinic, and Mayo Clinic radiologist, Dr. Tara Henriksen. Dr. Klassen, Dr. Henriksen, thank you so much for being here tonight. We appreciate it. So let's get right into it. Why is early detection so incredibly important?
We know that early detection improves outcomes. When cancers are found smaller, when they haven't had a chance to move to the lymph nodes, outcomes are going to be much better, and the treatments are going to be less intensive and less long-term morbidity.
Right. So what type of things should women be looking for? I mean, we always talk about self-examination, and we're going to get into fibrous breasts in just a minute. I unfortunately have fibrous breasts, so I never can succeed on my own in doing self-examination. So what do you have advice to women on, that process?
I usually tell women that it's important to look in the mirror. It's surprising how many women don't tend to look closely in the mirror. But look for changes in symmetry. Look for dimpling of the skin. Look for a bulge, nipple being flattened or inverted. Those kind of changes. And then occasionally while you're in the shower, you're soapy, you're already kind of slippery, just running the hands over the breast tissue, not doing an exam like your doctor would do, but kind of, a light compression on the breast to see if there's anything that jumps out at you.
So there's nothing really a symptom, really? There's really no symptoms to breast cancer unless it's advanced, and by that time it's probably a little too late.
Right. The majority of the time breast cancer is asymptomatic. It's not typically painful. Sometimes you can see changes a little bit sooner than others, but most often it's picked up on screening imaging.
So Dr. Henriksen, there we were talking about fibrous breasts, and we've been hearing a lot about it in the news lately. Let's talk a little bit more about why it's become so incredibly important with regards to breast cancer.
Absolutely. We know that breast tissue is a combination of fatty tissue and fibroglandular tissue. And when there's a little bit of mismatch in the volume of fibroglandular tissue, that's what we call the dense fibrous breasts. And that makes our imaging more difficult. It's more white on our imaging, and it's more likely to hide cancers.
Yes, and I've seen images too where you compare the two, and we could probably throw a couple of those images up. But when you look at a regular mammogram, you see a lot of white. But then when you do a specific type of imaging, you see just pretty much the breast cancer lump. Let's talk about those types of diagnostics.
We do. So in our patients that have that dense breast tissue, recommend additional imaging. We call that supplemental imaging, might be something that you hear. At Mayo Clinic, we use molecular breast imaging, and that's the test where we give the contrast, a radio tracer, that lights up that breast malignancy that's hiding in the dense breast tissue. And so that's one of the tests that we use. There's multiple other things we can do. Recently, a lot of the organizations in the United States have started recommending MRI, which is a test we used to reserve only for the very high-risk patients. So that's another option, and that has a similar method of detection where we give a contrast dye, and again, it does make that cancer stand out from the background dense breast tissue.
Now, is this something generally that your doctor would recommend, or do you advise women at home, and men, we'll talk about that too, to do their own research and go in and request these types of diagnoses?
I would say, it's something that should be discussed with your doctor. If you have a family history of breast cancer, if you have other risk factors, it's a very good idea to bring it up and ask your doctor, can we talk a little bit more about what my risk is? There are several options for ways to evaluate a patient's risk and determine if she's more average risk or if she's got higher risk, and we should be thinking about doing enhanced screening, such as the MRI that Dr. Henriksen mentioned.
Right, and I know it's becoming more and more common, and insurance companies are kind of looking at it a little bit more than they did before, because a lot of times women might have to cover those expenses themselves. So hopefully that will be changing for women in the future.